Welcome to Vlog 2, assessing skills and capacities with regard to sprinting and change of direction. The aim of this vlog is to evaluate whether there are underlying capacity issues involved in the analysis of an athlete's sprinting and change of direction performance. A skill reflects the athlete's ability to control their body accurately, efficiently, and in a timely manner. A capacity is the athlete's ability to express a given quality, for instance, the maximum force they can express, the range of motion of their joints, or the amount of time they can sustain a given task. Here we have a former cricketer performing a standing start sprint. His speed off the mark is not what it used to be, and his ability to accelerate needs assessing in order to determine the best method of improving this. It was observed that he rises quite quickly, which reduces the forward lean, therefore affecting his acceleration potential. In order to analyse further, he was asked to perform a sprint from a 3-point stance. This further highlights the rate at which he comes up to an almost fully upright position, which not only affects his ability to accelerate, but will affect his maximum velocity as well. Because of the athlete's upright position, the lead foot lands in front of his centre of mass, increasing braking forces and reducing overall velocity. If we freeze the video here, you can see that the athlete has a limitation in knee drive. He would benefit from bringing the knee higher, as the higher the athlete can bring the knee, the more downward force can be created, which increases ground reaction forces in order to improve forward propulsion. If we analyse the left-hand side, knee drive is better, however there is a lack of dorsiflexion at the ankle which will limit joint stiffness and the effectiveness to utilise stretch shortening cycle within the Achilles tendon. The athlete does, however, have good extension at the hip, knee and ankle on the right-hand side, meaning the athlete has the ability to maximise ground contact time in order to generate force. The athlete also fails to maximise the amount of heel pullback possible on the right-hand side. Elite sprinters will drive the heel back almost as far as their backside in order to increase the speed at which the tail leg comes through. This limitation can be attributed to a lack of hamstring strength or an inflexibility of the quadriceps. On the left-hand side, however, there is a much better heel pullback, so drills to improve heel pullback could be beneficial. In order to promote knee drive and ankle dorsiflexion, the athlete is asked to perform a wall drill. The red line is used to make sure the athlete is promoting a forward lean position and making sure the lead foot contact is behind the centre of motion. The wall drill is progressed to add a double leg drive. This is designed to improve ankle stiffness and utilise the stretch shortening cycle more effectively, therefore reducing ground contact time and minimising braking forces. The athlete is then asked to practice A skips and high skips. The athlete is competent at these two drills and knee drive is improved. However, the athlete is landing on his heel first, which is suboptimal for sprint performance. In an attempt to fix this, the athlete performs B skips, which promote the aggressive plantar flexion and increase rotational velocity at the ankle. The athlete has shown that he has the ability to complete most of these drills competently. After these interventions, the athlete is asked to sprint again, and this time, in order to improve forward lean, the athlete was asked to perform a falling start. There is immediately an obvious improvement in many of the limitations highlighted previously. The lead foot lands behind the centre of mass, the knee drive is a lot higher and the heel pullback is improved exponentially, with the heel reaching the athlete's backside as the trail leg passes over the lead leg's knee. This would suggest that the limitations highlighted during the initial sprint performance footage are most likely down to the skill issues and have easily been rectified with a number of simple interventions and drills. This is not to say that the athlete is a perfect sprinter, and clearly improvements can continue to be made. However, the issues highlighted appear not to be linked to the lack of force production or a lack of mobility at the joint, as during the skills he showed these were not limiting factors. Here we have a rugby player who's being asked to accelerate over 15 metres. Within the first few steps you can observe that he doesn't fully extend at the knee of the trail leg during the push-off phase. This will limit the amount of ground contact time he has to produce forward propulsion. This means that he is producing lower levels of horizontal propulsive force and will not accelerate as effectively. He doesn't appear to dorsiflex at the ankle effectively as the trail leg follows through, which will limit tension at the Achilles tendon and reduce the elastic potential of the tendons. Improving tendon stiffness has been shown to increase horizontal forces without utilizing contractile muscle strength, as well as limit deceleration due to joint flexion. The drop jump can be used to train lower limb joint stiffness and improve rapid contraction of the tibialis anterior. If we freeze the video here, however, we can see that the athlete collapses at the knee, showing a lack of eccentric contractile strength in the quadriceps, and further highlighting his tendon stiffness limitations. Assessing these two observations together, there is certainly a lack of quadriceps strength as well as potentially a lack of mobility at the knee or hip. The athlete weighs 95 kilos and has a 1 rep max back squat of 120 kilos. Here we can see him performing a squat with 100 kilos. This is certainly an aspect the athlete needs to improve on, with sprint ground reaction forces generally exceeding double body weight and in some professional athletes being recorded as high as 5 times body weight. Lower body strength and joint stiffness need to be a priority in this athlete's training. The athlete may also have iliopsoas tightness. A Thomas test is used to verify this, however the athlete does not appear to have a limitation here. So general lower body strength is clearly a limiting factor in his sprint performance. A number of other drills were prescribed in order to speed up glute and quadricep contraction in an attempt to maximize the athlete's ability to increase force production. Here we have an explosive step up, a box jump, also useful in improving ankle control and stability, and a wall drill in order to promote rapid dorsiflexion at the ankle and improve ankle stiffness. Lastly, the athlete performed a rear foot elevated front foot cycle. This aims to improve the speed at which the legs travel through the running pattern and also create high ground reaction forces on contact, therefore training the athlete's ability to withstand high eccentric forces. In summary, our first athlete appears to have fewer capacity issues but lacks the ability to put it all together to be truly effective during the acceleration phase of the sprint. However, after completing a few drills and being coached, his sprint performance improved, suggesting he had more of a skill deficiency. The second athlete, however, had a number of easily recognizable capacity limitations and needs to reassess his training program in order to improve these limitations. Here we have an athlete performing a cut. In real time, it appears to be efficient. However, when we freeze frame the footage, we can see that the left leg collapses slightly on impact. This can be due to a lack of stability at the knee and hip, or an inability for the quadriceps and glutes to manage high eccentric ground reaction forces. As previously highlighted with regard to the athlete's sprint performance, general lower body strength is considered to be a limiting factor. Therefore, it would make intuitive sense that this is the case with regard to the change of direction as well. When assessing the same athlete performing a T agility drill, we can see further collapse of the outside leg on both the right and left turn, and the athlete fails to use the inside leg to push off effectively. This could be due to a skill deficiency because the athlete has a lack of experience performing this test. It's important to note that the ground is incredibly soft as well due to the amount of rain we've had over the past few months, so this will limit the control the athlete has when changing direction rapidly, as well as an inability to utilize the stretch shortening cycle because of the reduction in the ground forces. The athlete does show a good competency during deceleration with good shortening of the stride length and an ability to absorb force in the lower limbs. He has quick feet, and this makes up for the limited tendon stiffness and a lack of ability to produce high concentric forces as well within the quadriceps and glutes. The athlete therefore needs to improve glute contraction. The athlete is seen here performing a glute bridge and a unilateral high velocity glute bridge. This is in order to improve speed of contraction at the gluteals, and a single leg box jump in order to increase concentric glute and quadricep force production. In summary, the athlete is a relative novice performing the T drill, and therefore with practice I am certain we would see a marked improvement. However, there are still certain capacity limitations with regard to concentric strength of the quadriceps and gluteals that need addressing, and a continuation of improvement of tendon stiffness at the knee and ankle.